Davis. Chair would now recognize the gentleman from Arizona, Dr. Gosar.
Mr. Roy, would you agree with this description of fraud, misusing a process to gain a financial advantage?
Yes, sir.
How about you, Ms. Lynch?
I think that's part of the description of fraud. Obviously, when it comes to criminal fraud, we would have to have intent requirements. But yes, that's part of the description of fraud.
What if it was the government? Would that still qualify in a process? Let me go a little deeper. How about that? How do we audit our federally qualified health centers? I'm going to give you some personal experiences. Just so you know, I'm a dentist. I've been practicing 25 years until last year. Why on the WIC program would it take a single mom most of the time 5 or 6 visits to see the doctor? Repeated entry, not on the same day. Why would we take a child with a full mouthful of decay and only allow one tooth to be taken care of one at a time? Can you describe why would we do that? How about you, doctor? You're talking about processes. What kind of process would mandate this kind of care?
I'm not familiar with those policies, Dr. Gosar, but
do you know what an encounter is?
Yes, sir.
Why would that be misused?
I can understand your concern if that's what you were observing.
I'm alluding exactly to that. Why would we? What's the purpose of an encounter?
Purpose of an encounter, sir, of course, is to deal with the patient and the issues the patient has and try to take care of them.
How about we take 5 different visits for a WIC woman to be able to fill out a health history, and that took 5 weeks, 5 different visits for an encounter. Would you not call that fraud?
I'm not familiar with the situation that you're describing, but I certainly don't. That certainly doesn't strike me as the best way to go about business of taking care of patients, sir.
When you look at processes, how do we review the process when we're looking at FQHCs? You said that you constantly are updating and looking at processes. How do we look at that process?
In our area, sir, the work that we're doing focuses principally on both Medicare payments and Medicaid payments. And so we look at the way that the money flows and look for patterns of problems no matter where the money is going. So we intend to look no matter where the money is going. I can't tell you that I'm familiar with a particular emphasis on the kinds of issues that you're talking about, but certainly we're looking at all of the ways that the money is flowing and the possibilities for problems like that.
What kind of audit do you do on a federally qualified health center or a health center? And when are they done? Are they announced or are they unannounced?
I'd have to get you specific information on that, sir. It's not something that I'm personally familiar with at this point.
I wonder if I was to tell you that it's standing procedure that what we do is we have standing patients that come in to see services on Medicaid, and they're supposed to be seen first come, first serve. And they sit all day long, and they just get transferred to a hospital, and they're isolated to one segment of the day. Wouldn't you call that fraud?
I'm not.
It's a process, right?
It sounds like
an inappropriate process, right?
It sounds like a process that would need some attention to me the way you describe it, sir. Yes.
Mr. Roy, you said that you look and review these kind of processes. Would this be something that you've looked into before?
Sir, Office of Investigations does not look into such processes.
How would you have to go back into looking at them?
I'm an investigator. Our office investigates fraud and brings those cases to a criminal prosecutor, either at the Federal or State level. The audit process would be from another component within our OIG.
And where would that come from?
Our Office of Audit. And I'm more than happy to find out and get additional information for you on that process.
Mrs. Lynch, would we persecute that individual that was the head of that health center for that kind of misuse of patients?
Congressman, I hope that we don't persecute anyone.
Prosecute, I'm sorry. It's been a long day.
It's okay, I'm sorry. On the facts as you've described, I simply don't have enough information. It certainly sounds like an inefficient process, but I would have to know more about it.
But if we had an administrator misusing the process, fraud, that's misusing a process for a financial aspect and an upward gain. It seems to me like we got to do a much better job on that, because we're seeing a lot of this. It's not just the private sector. It's also the government and the entities that it pays. I yield back my time.